Have you ever wondered what vodka does to the penis and to your sex life, especially once you are over 60? Let's discuss it calmly, in a didactic and practical way. What happens in the short and long term, why vodka, or any strong distilled spirit, can affect you more in old age, how to minimize damage, what warning signs you should not ignore, and what concrete steps to take to recover or protect your sexual health. First, the most direct point. Vodka is a high-proof alcoholic beverage. This means it delivers pure alcohol in a concentrated amount, and alcohol acts in the body as a central nervous system depressant and as a toxin for key organs. In the short term, one drink can relax you and lower anxiety, sometimes facilitating the start of a sexual encounter. The problem arises when you cross the line from a low dose to a high dose or a binge. In the same night, excessive vodka consumption reduces the ability to achieve and maintain an erection because it compromises the nerve signals coming from the brain, depresses the erectile response, and alters the vascular coordination necessary for rigidity. This is why many men report that after heavy drinking, it doesn't work well for them. Furthermore, alcohol increases drowsiness and decreases sustained lubrication and arousal, which can make the act shorter, less satisfactory, or frustrating for the couple. In the medium and long term, the effects become more significant. Chronic and elevated vodka consumption damages the endothelium, which is the layer that lines the arteries. Penile arteries are small and sensitive. When the endothelium becomes inflamed or hardened, the ability to dilate and allow blood flow decreases, leading to vascular-based erectile dysfunction. Vodka also contributes to insulin resistance, increased abdominal fat, and hypertension, all conditions that worsen circulation and, therefore, erection. Alcohol affects the liver, and the liver regulates hormones. Chronic liver disease induces hormonal imbalances with a relative increase in estrogen and a drop in testosterone, which reduces sexual desire and can alter muscle mass and energy. Continued consumption can cause peripheral neuropathy, damage to the nerves that transmit sensations from the penis, leading to loss of sensitivity or problems in the transmission of the signal for ejaculation and erection. There are effects on ejaculation and orgasm that few people mention. Vodka and frequent alcohol use can cause delayed ejaculation or difficulty ejaculating. In other cases, a lower ejaculatory volume is observed. These changes affect the sexual experience and can generate performance anxiety, which in turn feeds the dysfunction. Also, drinking to loosen up from shyness can lead to risky sexual behaviors. Unprotected sex with new partners, and greater exposure to sexually transmitted infections, something relevant at any age, including after 60. Drug interactions are another critical point. Many older men take medications for blood pressure, the heart, the prostate, diabetes, or mental health. Alcohol can potentiate hypotension when combined with certain antihypertensives and can enhance the sedative effects of anxiolytics or antidepressants. Mixing vodka with phosphodiesterase 5 inhibitor medications, such as sildenafil, is not prohibited in all cases, but excessive drinking along with these drugs facilitates a drop in blood pressure, dizziness, and fainting. If you take nitrates for your heart, mixing them with alcohol or any oral vasodilator can be dangerous. Therefore, it is essential to review your medication with your doctor before regularly consuming alcohol. For older men, alcohol tolerance decreases with age. The percentage of body water decreases and liver metabolism changes, so amounts that previously seemed reasonable now have more intense effects. This means that the general recommendation is not the same as for young adults. The older you are, the more conservative your consumption pattern should be. A sensible guideline for older men is to limit intake, prioritize alcohol-free days per week, and avoid drinking quickly or on an empty stomach. It is helpful to remember that one measure of vodka is equivalent to a small shot, and drinking several measures consecutively is a significant hit to the cardiovascular and sexual systems. If you are considering reducing or quitting vodka, keep in mind that much of the damage is reversible or improves over time if action is taken. Improvement in energy, sleep, and mood can be noticed within days to weeks after reducing consumption. Improvements in testosterone and some metabolic markers usually appear in weeks to months. Recovery of vascular function and erectile potency, when the damage is not extreme, can be observed between a few weeks and several months by combining abstinence or reduction with exercise and control of other diseases. Alcoholic neuropathy is slower to improve and may require months or more time, and in some cases, the damage is irreversible if it has been very advanced. What should you do today to protect your penis and your sexuality? First, talk to your doctor and review your medication. This avoids dangerous interactions. Second, set clear limits. Reduce the frequency of consumption, avoid binge drinking, and prioritize at least 2 or 3 alcohol-free days per week. Third, hydrating and eating something before or during intake decreases blood alcohol peaks. Fourth, improve habits that favor circulation. Walk or do regular aerobic exercise, control weight, sleep well, and reduce tobacco use. Fifth, if you have diabetes or hypertension, work with your healthcare team to optimize them because that amplifies any benefit to erectile function. Sixth, train your pelvic floor with simple exercises that improve control and firmness. There are clear signs that indicate you should seek immediate help. If after drinking you notice chest pain, difficulty breathing, syncope, or loss of consciousness, seek urgent care. If you observe a total inability to achieve an erection accompanied by other symptoms of liver disease or systemic failure, seek medical evaluation. If you experience priapism, a painful and prolonged erection that lasts for hours, go to the emergency room. Although alcohol itself does not usually cause priapism, the combination with medications or underlying conditions can trigger it. If you feel persistent dizziness, falls, or confusion after drinking, consult a doctor because these may be effects of drug interaction or signs of intoxication. On the emotional side, it is important not to underestimate the effect of vodka. Chronic consumption is linked to depression, irritability, relationship problems, and loss of interest in sexual life. The partner may interpret sexual avoidance as disinterest, which fuels conflict. Talking with your partner, reducing alcohol together if possible, and seeking psychological support or help groups when consumption is problematic are strategies that care for both mental and sexual health. For those who drink vodka and are concerned about fertility or visible changes in the penis, it is prudent to consult a urologist. A basic evaluation will include blood pressure control, glucose analysis, liver function tests, and, if appropriate, measurement of hormones such as testosterone. The urologist can guide you on specific therapies for erectile dysfunction if it exists, and recommend referral to mental health or addiction services if the pattern of consumption is problematic. In summary, vodka can be a social companion, but in old age, it has more adverse effects on the penis and sexuality. In the short term, it depresses the erectile response and orgasm. In the long term, it contributes to vascular damage, hormonal drops, neuropathy, and emotional problems that erode sexual life. The good news is that many of these alterations improve by reducing or eliminating alcohol and combining that change with exercise, control of chronic diseases, and professional support when needed. If you are concerned about your consumption or notice changes in sexual function, take action. Consult a doctor, reduce progressively, and prioritize general health. Taking care of your body is taking care of your pleasure, and it is never too late to improve both.